Therapeutic communication. This one is a classic question from nurses who have, I guess we could say it's classic from newer nurses. Let's just go with that, newer nurses. Question from the tribe. This was actually posted on my YouTube channel community page, talking about maintaining professionalism versus getting personal with when you talk with your patients, communicating with your patients. How do you find the balance between maintaining professionalism and having a casual personal conversation with your patients? This stems from that class that you have in basic nursing school, entry-level nursing school, when they discuss the negative aspects of transference. And for those that don't know maybe or don't remember, transference has to do with turning your relationship with your patient from a patient and provider communication to sharing personal information and becoming emotionally attached. You start to invest in personal gains for yourself as well as for the patient, and you may treat the patient differently. Instead of treating them like you would treat any other patient who comes in with this particular illness, you're going to treat them differently. You're going to treat them special. I used to have a lot to say about this. I used to get very upset that people would think that transference is a bad thing, but transference can be bad if it's abused. It's just like anything else out there in the world. As long as you're doing it in moderation, it's not harming anyone, and in fact, I think it's a good thing. How do I balance the professionalism and personal relationship? I make sure to maintain some anonymity when it comes to sharing information. I'll share simple things like being married or that my wife and I are nurses. May even share some information on my history as a nurse. But I don't share information that has nothing to do with the nursing profession. Very rarely, when it comes to the specific illness that we're talking about, I might share a personal opinion. And I will say those words out loud. When a patient, a family member, a friend says, they ask me, well, what would you do? What if this was your dad? What if this was your wife? What if this was your mom? What would you say to them? What would you do? And I make sure to say the words out loud. My personal opinion would be this. And I make sure that the family and the patient understand that I am not investing or recommending any particular decision or any particular thought or camp of thought. I want them to understand that I have to maintain professional recommendations, but I'm also a human being. I also have my own personal feelings. I have a family. I have loved ones. I have friends. And if it was me sitting in their shoes, standing where they are, what would I do personally? But my personal decisions are usually influenced by my professional knowledge. And I make sure to say those words, that because I've been a nurse for 15 years and I've been a nurse practitioner for almost half of that time, and that I've been in healthcare for almost 25 years, that my decisions are going to be influenced by those things. Unlike my patient or their family or their friends. They may not have the knowledge and the skills that I have. And I want them to understand that it's okay for them to be conflicted. It's okay for them to be scared, to not understand something. That's why I'm here. That's why we're here, to try and bridge that gap. So if I had to give it a percentage, 85% of the time it is professional direction. 15% of the time I'm going to share something personal, or I'm going to allow there to be a personal conversation. Is that set in stone? Is that the only thing I do? Absolutely not. You have to play it by ear. You have to gauge every conversation. I'm imagining every nurse out there can give a story on how there were certain patients that you completely connected with. They got you, you got them, that you just meshed. You had a good time, or it was fun to take care of them. No matter how sick they got, no matter how sick they were, your personalities connected. And maybe you're able to connect with them on a personal level. And there are patients out there that you just never connect with, that they are foreign to you, that you literally are there to do a job and that's it, because you just don't connect. And that's okay. You're human beings. We're not machines. You're going to connect with certain people and you're going to not connect with many people. It's completely okay. Don't try and force a connection that's not there. That doesn't help the patient in any way. And at the end of the day, no matter how you slice or dice this, it's about the patient and the patient experience and how you impact their life. Did you improve them in some way? Did you give them something that they can take with them when they leave your care? And I think that's the most important aspect of this therapeutic communication. It's making that connection so that they can improve their situation and be better than they were when they first met you.